Hello, everyone. Today, I will present a One Health analysis of a Salmonella outbreak linked to Greenfield Farms. And my focus will be on how human, animals, and environmental factors contributed to this outbreak and how we can prevent similar events in the future. All right, so over a 2-week period, the local healthcare providers in the community observed a spike in gastrointestinal illness. The local hospital admitted about 15 patients with severe dehydration and gastrointestinal symptoms. They actually conducted a laboratory test confirming Salmonella enterica. These patients presented with symptoms like diarrhea, fever, and abdominal pain. So across-board investigations were done as well to actually find trying to find where the problem was actually from. And within these investigations, a necropsy on a dead chicken revealed lesions consistent with Salmonella infection. The farm veterinarian indicated that several cows showed signs of mastitis. Surprisingly, the majority of patients that actually were hospitalized were said to have taken unpasteurized milk from Greenfield Farms. Public health officials tested water from the nearby streams that people used for irrigation and discovered Salmonella infection in it. It was also found that the farm manure that was applied as fertilizers to crops were used without any prior treatment. And it was also reported that the heavy rains that the community experienced the previous months in overflow were from the farms into the waterways as well. So let's talk about the transmission routes of this disease. So within this outbreak, because of these investigation results, we saw evidence of animal to human route of transmission, which included foodborne transmission with the infected raw milk and poultry products, as well as occupational exposure. So these people might have handled infected animals. Also evidence was animal to environmental route of transmission, where we have these manures that were infected, as well as environmental route of transmission, where we saw the evidence of contaminated streams. There is also evidence of cross-contamination, where we find humans possibly consuming infected crops. And let's talk about the risk factors in this transmission. So when it comes to the risk factors, we can see that investigations actually reviewed multiple risk factors, including raw milk consumption from disinfected cows. These cows were said to have been infected with mastitis. We also saw evidence of infected chickens, which eventually infected the produce that came from them, and their droppings, which were not treated, eventually used on the crops, contaminating the crops, which will eventually be consumed by humans, as well as contamination of the nearby stream with manure runoff. And furthermore, we see that this contaminated stream can actually affect humans either by irrigation through the crops that will be infected and consumed by humans, or human actually having recreational activity around these streams as well. Okay, so the One Health approach actually helps us to understand how human health is interconnected with animal and environmental health, which is essential in explaining this outbreak. So this outbreak is not just a single source issue, it's a multidirectional system failure across humans, animals, and environmental health. All right, and we can see here in this outbreak that humans, animals, and the environment played different roles in it. Talking about humans were exposed through multiple pathways, particularly the raw meat consumption from contaminated cows and contact with contaminated water, also recreational exposure to contaminated environments. We also saw the animals. So these livestock actually served as reservoirs of infection, with both dairy cattle, and poultry contributing to the spread of Salmonella. And environment was not left out. Environment acted as a key transmission hub, spreading contamination from the farm to the community through contaminated stream irrigation and recreational exposure and runoff after rainfall. So talking about the stakeholders engagement in this outbreak. So the managing this outbreak requires collaboration among multiple stakeholders, each playing a critical role in control and prevention. So these key stakeholders will include epidemiologists, the policy analysts, environmental health officers, laboratory managers, county officers, and county veterinarians as well. So epidemiologists will actually work to track cases and identify sources of this infection. The policy analysts will help to develop regulations and preventive or prevention policies. The environmental health personnel will help to monitor water and sanitation risk. The laboratory manager will help to confirm pathogens and ensure test accuracy. The county officer will help to coordinate response and public communication. The county veterinarian will help to manage animal health and farm biosecurity. All right, so these animals has to be treated, and implementing biosecurity measures to also prevent further spread. All right, so let's talk about immediate action. So for this outbreak, our immediate priority is to break the chain of transmission. So immediate intervention will focus on stopping the exposure, treating the patients, controlling infections at the farm level. So they have to ban for exposure, they have to ban the sales of unpasteurized milk, restrict access to contaminated stream. There has to be rapid diagnosis and treatment and public awareness as well about the symptoms. On the farm level, the animals that were infected has to be isolated and treated severely as well. And also there has to be water advisory issuing, like boiling of water in affected areas. All right, so for the long-term prevention and short-term prevention is also very, very important for this as well. So the long-term prevention requires coordinated strategies across all these sectors, including safer farming practices, environmental protection, and improved food safety systems. All right, so it is important to know that the key to preventing future outbreaks is integration, ensuring that all sectors work together rather than in isolation. Okay, it is very, very important because One Health approach emphasizes collaboration, data sharing, and coordinated responses across sectors towards tackling a public health problem. So my reflection here, so this case highlights both the strengths and challenges of One Health approach, especially the need for collaboration across disciplines. So beneficially, One Health provides like a holistic understanding of diseases transmission. It helps us to identify hidden links and helps us to be more effective and provide sustainable solutions. Challenges could be the problem of coordinating between sectors, getting data sharing, having barriers in that area, and maybe having limitations to resources. So in conclusion, this outbreak demonstrates how interconnected systems can drive disease transmission and why a One Health approach is very essential for effective prevention. Thank you very much.